So one of my multi-prong approaches in building health and also assisting folks who either feel like they have or suffer from depression or have a diagnosis of depression is exercise. And before you pass or scroll on, I'm going to talk a little bit about exercise in some detail because part of my job is to help you meet your goals. And I think we all know without even talking to a practitioner or a doctor or an herbalist or anybody in the health and science field of any kind that we're supposed to exercise. And so this idea that folks who work with people with depression or illnesses just write down, an exercise program and hope it's going to help their client. In my experience, in my practice, it's kind of silly, actually. We got to dive into it a little bit more than that. And so I'm going to talk today about 3 reasons that I think are obstacles for folks to exercising, even though they know it would benefit their health, and how I help folks overcome those obstacles. So there's more than 1,000 clinical trials, if we're going back specifically to depression, that show that there's this relationship between exercise and depression, preventing depression or helping improve depression. So there's pretty great evidence out there. And there's a lot of great evidence out there that shows that exercise prevents disease, prevents the onset of obesity, diabetes, cardiovascular disease. I mean, we could really go on. It's not just depression, but exercise in particular does seem to really help aid folks with depression, make pretty marked improvements. But the first thing that comes to my mind, especially specifically with depression, is asking a person who, if their depression's severe, who has trouble getting out of the bed in the morning and even getting dressed and getting on with their day to go exercise is, I don't know, is that even useful? The other thing is there's some evidence that a lack of exercise can cause depression. That hasn't been studied quite as much, but if we stop and think about it, depression isn't a modern day disease, but I would say the CDC says it's 1 in 10 in the United States. And, just going back to that building health, I mean, the amount of cardiovascular disease, mental health issues, diabetes, the amount of all these diseases, it's growing exponentially. And so in some ways, this is a modern lifestyle problem. And if you think about it, unless you were from a very small, a very specific social class for, thousands of years, you were hunter, gatherer, agricultural farmer, there just wasn't an option to not move your body. So it tells me we're biologically made to move. And so it makes sense that we would get sick, and that can include depression when we don't move. But let's talk about some reasons why folks might not want to move. And so one of the questions I have on my intake form is just, do you exercise? And when someone says no, one of the first things I ask them, not to make them feel guilty, but just to understand how I can help them, is, why don't you exercise? And a lot of people haven't really sat down and spent a lot of time reflecting on really why. So it's usually just I'm tired, I don't have time, I don't like it. That's what it is. But when we dive a little bit deeper, I sometimes ask, so when you move, is it just that you don't like the exercise, or is there a possibility that there's some feelings coming up that you don't like or that you didn't want to deal with? And most of the time when I ask that question, people are like, I don't know. And the reason they say I don't know is they don't even have an awareness that this is a possibility. So, there's this theory of what we call bioenergetics, which basically in this theory says that all of our emotions are stored in like the musculoskeletal system of the body and into the fascia, and that when we move, these feelings can be released. I think a pretty widely accepted understanding that, yeah, there is something physical in the body with depression. And so sometimes just bringing an awareness to someone that, hey, there's a possibility that when you're moving, some of this comes up. And so you're associating it with exercise when it really should be an association with the movement and the feelings coming up that's the issue. And sometimes that's enough for folks to go, oh, I never thought of that. And so then the next time they go to exercise, this awareness now helps them not think negatively about the exercise and instead start to focus on, okay, I got this feeling coming up, acknowledging it, but then letting it go. You know, and then on the flip side of that, you got your folks who actually work out all the time because they figured out that that release of emotion feels really good for them. And so they keep exercising and they like it. But I don't usually have to ask that question to those folks because they're already on a program and that's not one of their hurdles. But for some folks, it's so much when all of that comes up that those kind of techniques to kind of help them work through it isn't something they're able to do on their own. And they need some more help and assistance holding those emotions as they come up. And sometimes even need some professional support by a therapist who does work with these bioenergetics and some of the different types of therapies that I talked about. Somatic therapy is very popular. And that is enough for them to then kind of move and work past that. And then because they're now differentiating the feelings and emotions coming up with movement from exercise, they are able to start an exercise program. The second thing that sometimes isn't taken into consideration is pain. A lot of people, they are only thinking of somebody with like a severe like diagnosed back pain or they can't get out of bed, but a lot of folks are walking around and they've had these holding patterns for so long that like it hurts to stretch, it hurts to move. Some of it is because these holding patterns, you know, you've got an overdeveloped muscle in one area and it's compensating. Sometimes it's like from postural positions. A lot of folks unnaturally sit in one position and at a desk all day. And they have this tension that creates a holding pattern. Some of it's just stress, and you know, sometimes it's hot on the stomach or the lower back or the neck and shoulders. But we know there's a problem when you're in that situation and it's stressful, but when you go away from the situation, you can't then just relax. And that's when these holding patterns stick in. And when we have these holding patterns, we start to get ischemia. We start to get a lack of blood flow to the area. Then we start to see a lack of synovial fluid. Synovial fluid is what, you know, helps our joint. You can think of it as joint lubricant, right? And so then folks start guarding because it hurts to move. But then the lack of blood flow and the spasm and the dryness and the lack of synovial fluid gets worse and worse and worse until they can't move at all. And so I know it sounds counterintuitive, but a person who's dealing with that, it's going to feel terrible to go exercise. So then just telling them to like walk go exercise, walk this many days a week, do 2 days a week of strength training, kind of like telling the person who isn't realizing that the movement is not good for, that they're not able to handle the emotions coming up. It just isn't helpful. And then we also know when we've had those holding patterns for a while, every day the fascia, you can think of it as like a web that starts to grow over. And the reason it's important to stretch is when we stretch, it re-releases that and breaks it up. Every day that we don't stretch, and we don't stretch when something hurts, we don't stretch when it's uncomfortable because there's not blood flow, we don't move that when there's a holding pattern, it starts to get really thick. So instead of a web, you have to think of it almost like a root. And now breaking that up is going to require someone to physically go in there and get rid of it. And so now in order to get a person moving and exercising, I have to work with them with herbs and that help get the synovial fluid going, working with them for helping get blood flow going, releasing those holding patterns. Sometimes there's other body workers or practitioners that we have to get involved. And this person is not going to get over their depression if they can't move. And so we have to look at why can't they move. Also, we've just got the folks who like haven't moved in such a long time that, you know, your muscles are weaker, your endurance is lower. It's hard to get out there. And if you don't even have the motivation to get out of bed, how in the heck are you going to start to exercise? And so a lot of times folks, especially when they're dealing with depression, oh my gosh, they beat up on themselves and they're so hard on themselves. So then they go in and have this great idea for this great exercise routine. And then when they can't maintain it, just feel discouraged and then they just quit. So it's a little bit about like the fad dieting. And so before we can build habits, we've got to build routines. And the thing about routines is routines are uncomfortable. Building a routine takes a concerted effort. And so this is where, you know, I have a question back to the SSRI. So not always. Sometimes I'm able to help folks build routines slowly, right? So like depending on where they're at, you know, we don't start with something big. We start with something easy and doable. So they agree to wake up in the morning, that they're going to go outside while drinking their coffee and do 10 neck rolls. And, you know, a few just like simple stretches just to get the blood moving. And then maybe a 5-minute walk after dinner, if that. And just starting with building these like micro routines that become habits of a little bit of movement and then, you know, moving to the next thing. But yeah, back to the pharmaceutical route. Sometimes I've had folks with like some pretty severe depression who, you know, they have the whole protocol, but these protocols, including taking the herbs, it takes time and it takes effort, and they're so depressed they can't do the first step of the protocol, including exercise. And these are folks who I sometimes seen take an SSRI antidepressant for a real short amount of time, and it just helps them get over that hump. And so maybe it wasn't helping with their serotonin levels, but maybe there's some other reasons that these medications that we don't know about helped. They've also done some studies that said the placebo effect isn't much different than the other. Maybe it's the placebo effect. I don't know. But I'm just saying I have seen in my practice folks use the aid of an SSRI for a short amount of time to get over that hump, and then they back off and get into the routine. Now, not everybody needs that, but I'm just trying to be transparent here about all of the possibilities. And so it's just, you know, building that routine, building that micro habit, having coaching, being in a safe place where like, if you didn't get there, that's okay. Sometimes, gosh, this is a whole other subject, stimulant herbs. Sometimes, while it's not a long-term help, it is a Band-Aid approach. A client needs just some immediate relief so that they can do the program to get to the root cause. So just like if I'm trying to help a person exercise and they have holding patterns, I might give them some herbs to increase some blood flow. That's an antispasmodic to help increase synovial fluid. Just like I might with the person who's having trouble dealing with the emotions in their bodies. We might look at some herbs that they really connect with, that when that emotion comes up, they have a sense, you know, we build on the sensory system. The sensory with that herb helps support them with dealing with that emotion. And then also sometimes when folks are just fatigued and have those first steps, some folks choose, you know, an SSRI route. Some folks, we do use a little bit of some of our stimulant herbs, and that helps them just get that little bit of extra energy to get over that hump so they can exercise. And then that leads me to some of our next building health videos, which is nutrition and sleep. So also you have to look at, is a person not exercising because they don't have physiologically what they need? They have nutrient deficiencies. Or are they not sleeping and and we know a lack of sleep can also lead to depression and a bunch of other diseases. So is the lack of sleep making it so that they can't exercise? And then we also then know sleep and nutrient deficiencies can also be one of the root causes of depression. And there we're at the like chicken or egg approach. And so I hope today this was helpful. If anything, kind of help shed some light that even something as simple as saying exercise to help yourself, that we've got to dig deep and figure out like why is it hard to exercise, and what herbal tools not to do. I'm not talking, I think people thought I was going to get on here and be like, hey, so what herbs help with depression? Nope. That's way up here at the top. We're down on the building. And so step one, if someone can't exercise, what herbs assist, and what are those real root reasons that folks are struggling? And folks put a lot of pressure on themselves. There's a lot of like shame, and there's a lot of like just a lack of self-love when we can't get there. And having someone just say, hey, wait a minute, it's not your fault. You didn't know these emotions were coming up and that you had trouble, dealing with them, and you thought it was the exercise. Oh, it's not your fault. You didn't realize that these holding patterns, that this ischemia made it feel bad, and it's not safe to just jump in, and let's get some tools for that. Oh, hey, let's start building these micro habits. Gosh, you might need a little bit of stimulation. You might need a little bit of help to get some relief so that you can exercise. Just that mind shift, just that shift, just really, really, really helps folks. And so I think from the viewpoint of a person who's seeking help, it's really important that you have a practitioner who is trained in client-centered care. Like that is really part of it. And it's important for us as practitioners to not just learn the like clinical study, here's the sleep, just learn the, look at a clinical study and say, oh, I need to tell clients to exercise, but realize if we're going to help them, we got to dive in a lot deeper. And there's probably a lot of other reasons folks don't exercise that I didn't even talk about today. But those are the ones I see most in my practice. And so I hope you'll like, subscribe, follow, because my next video on building health, we're going to be talking about nutrition, and more importantly, nutrient deficiencies and what medications you might be taking that are causing nutrient deficiencies and you had no idea. So thanks for watching today. And Vitae means path of life. And so I hope I can help you find your own path to better health.